In podcast episode number 62, I talked to Belgian researcher and manual therapist Barbara Cany about dry needling. Barbara is a professor at the University of Ghent with a special interest in the treatment of neck pain. She has published lots of papers on the topic, including various studies on dry needling. In the beginning of the podcast, Barbara defined dry needling as a technique that is mainly used by physiotherapists to treat myofascial pain, where a thin filiform needle is inserted into a specific trigger point of a muscle with the main aim to decrease pain and to restore muscle function. She mentioned other indications such as the treatment of neurological disorders as well as scar tissue and contrasted it to acupuncture, which is based on traditional Chinese medicine. We then talked about the so-called integrated trigger point hypothesis, originally developed by Travell and Simons. The idea is that you have a taut band in a muscle that is formed due to overload or trauma. If you're interested in the exact physiology behind the formation of this taut band, check out the whole podcast episode where we got much deeper into the details. Next, we talked about the physiological effects of dry needling. According to Barbara, they are both peripheral and central. She mentioned a study in rats that demonstrated that dry needling, the taut band in a trigger point, reverses the processes that form a taut band in the first place. You then get lowered spontaneous electrical activity in the muscle and as a consequence, relaxation. She went on to explain that a second effect of dry needling is on pain and inflammation. The sustained contraction of the trigger point causes local ischemia and a decreased energy supply. This leads to an imbalance with the contracting muscle that needs a lot of energy. In turn, inflammatory mediators are released that stimulate nociceptors, which are responsible for local pain upon palpation. Again, an animal study has shown that dry needling can reduce those inflammatory mediators and increase capillarity in the muscle, reversing the ischemia. Lastly, Barbara mentioned the central effects like the gait control theory, conditioned pain modulation, changes in skin conductance, and heart rate frequency, and a placebo effect, which are all understudied till now. We then moved on to talk about active and latent trigger points. Barbara highlighted that active trigger points give spontaneous pain at rest and during movement and compression. The pain can be local or referred, and the muscle might show a jump sign or twitch response, which are not present in latent trigger points. Those are only painful with compression and movement, but don't display recognizable referred pain. The level of pain and area of referral are usually greater with active versus latent trigger points as well. Talking about the inter-rater reliability to find trigger points, Barbara admitted that most studies show only moderate reliability. A Delphi study on diagnostic criteria for trigger points identified a cluster of 3 signs and symptoms. 1. Identification of a taut band. 2. Identification of a hypersensitive spot. And 3. Induction of referred pain. The twitch response did not appear to be a good criterion, by the way. We also touched on the phenomenon of referred pain from trigger points, which is different from the convergence projection theory we see in deep spinal structures. Barbara clarified that the leading theory is an expansion of the receptive fields in the dorsal horn. Again, we went way more into detail of this process in the whole podcast episode. Afterwards, we briefly talked about the twitch response. Barbara explained that multiple systematic reviews have failed to conclude whether the local twitch response is relevant to the outcome of dry needling. Clinically, it does seem to lead to better outcomes, even though those twitch responses often lead to post-needling soreness, which is the reason that the twitch should be avoided in patients with chronic pain. According to Barbara, more and more evidence is emerging for dry needling as a treatment to improve spasticity in patients with stroke, for example, as well as dry needling as a treatment for scar tissue. Looking at the evidence for dry needling on muscle pain, Barbara's research group published an umbrella review of all systematic reviews across all body regions. They found that dry needling is superior to sham or no intervention and equally effective to other interventions for pain reduction on short term. Results on function, such as range of motion, strength, and motor control, were contradictory. Several studies also show that dry needling has an additional effect combined with other physiotherapeutic interventions, compared to dry needling in isolation. Towards the end, we discussed adverse events and contraindications of dry needling. Major events like pneumothorax or excessive bleeding are rare, but they do happen. For this reason, Barbara stresses that it's essential that all practitioners who use dry needling follow courses to be qualified and to be able to practice safely. In 1 out of 3 cases, patients experience minor adverse events such as pain, small bleeding, and bruising. At last, we compare dry needling to manual pressure in the treatment of trigger points. Studies do not demonstrate any difference for superficial muscles. However, clinically, Barbara does see a better effect of dry needling in deeper muscles that can hardly be reached by manual pressure. We finished with Barbara's 3 main reasons to add dry needling to your toolbox. First, Barbara advocates that dry needling is a new clinical skill that can be a great adjunct in the early phase of treatment to create a condition to start exercising or other therapies. Second, learning dry needling has improved her anatomy knowledge by having to think 3-dimensionally. And third, she stresses that you will also improve your palpation skills. Her hope for the future is that we further increase the evidence looking at how dry needling might be implemented as well as when not to apply it. Alright, so this was a brief summary of podcast episode 62 with Barbara Cani. I hope I could raise your curiosity to listen to the whole episode to learn more about dry needling. If you would like to have more resources, download our Physiotutors app, it's free, and get access to the transcript and infographics. As always, thanks a lot for watching, and I'll see you in another video. Bye.